Welcome, everybody, to the Netrin Practice Transformation Grant webinar. We're going to give it just another minute or two to allow everybody else to log in before we get started. Okay. I think we can probably go ahead and get started. It's a little after 12. So thank you everyone for joining us today. We have Netrin with us. They are they're one of the vendors that we have chosen to work with the practices for the practice transformation grant. They will be walking you through your services that they're going to offer and how they partner with practices to drive meaningful transformation. So as they go over their overview, please think about your questions. You can type them in the chat box. Or you can wait until the end and raise your hand and then you come off mute and they can kind of talk you through some of this stuff. But take an opportunity right now. This time is to really get clear on what they will provide and how their approach could maybe align with your organizational needs. So with that, I'm going to turn it over to the Netrin team. Armani?
Great. Can you hear me?
Yes, we can.
Okay, great. No, first off, I'd like to thank Kim, the HSCRC, the CRISP team, and the Equip team for giving us an opportunity to present here today. We have done this before, and I know a lot of you have chosen us to partner with us for 2025. Look forward to presenting to you and partnering with you for 2026. I'm Armani Manisundaram. I'm the founder and CEO of Netrin Health. Netrin Health is a value-based care organization. We're going to go through our slide deck today. I'm also joined by Suniksha Casey, our Chief Transformation Officer, and Ipak Osgur, our Director of Engagement and Growth. Thank you for joining us. Next. So today we're going to be going over who we are, understanding, the ECHO program, the challenges, and what are the, what's going to be holding you accountable for your success, end-to-end support model for the EQUIP entities, and the project implementation and Q&A. Next. So these are our overall guiding principles since we started. Nothing has changed in the last 10 years or so. And again, some of the foundations that we laid through were to guide the independent primary care providers and other full care ecosystem to thrive in our value-based care economy. Me personally, I've been doing ACOs for the last 13 years and been supporting also health plans and others to drive from fee-for-service to value-based care. Again, the guiding principles are driving accountable care, advance health equity, support innovation, address affordability, and partner to achieve system transformation. These are our pillars, and these were mirroring the pillars of some of the CMMI goals and other goals across various value-based care organizations nationwide. Next. So in terms of our core enablement pillars, again, started out in the ACO enablement space for MSSP ACO, Medicare Shared Savings Program, then drifted into supporting commercial ACOs and ACO enablement in the commercial space, and also building out the platforms over the last dozen years, and trying to build out the various platforms needed to consume the various claim data from the various payers and creating that ecosystem for analytics. And then also supporting the specialty value-based care. And since 2019, we have been a care transformation organization for the Maryland Primary Care Program as a care transformation organization, and now going to be supporting practices well into 2026 and beyond as part of the AHEAD model. We built also other virtual care services models to support all this, to help guide them and support in terms of getting people to value-based care. Again, some of these programs are RPM, APCM, CCM, coaching, and others. And all these are just not in the terms of the fee-for-service arena, or how this could be helping practices, entities, and others move towards value-based care. Next. So again, I mean, we've across the board and across many years, helped in, partnering with over 325 providers across 85 practices, touched over 75,000 lives, and, saved a little over $44 million across various value-based care programs and with various payers. Again, me and the team have experience in working with the various value-based care programs with health systems, solo providers, multi-provider locations, FQHC, CBO, specialty clinics, and beyond. And again, here, I mean, majority of our work has been in the state of Maryland and across all parts of Maryland, and deep experience in terms of supporting the overall total cost of care model with the MDPCP and others. Next slide, please. So between me and the team and some of what we've done over the years, again, supporting various programs across various payer models, whether it be commercial, government payer models, and again, as part of the HSCRC and other work, wearing a hat of a health system, the overall total cost of care model, the global budgets and others. Also in terms of the MDPCP needs and working with the HSCRC, the Maryland Healthcare Commission, and now the EQUIP program to help everyone succeed, whether it be the primary care specialists and others, move them from fee-for-service, understanding what those trigger elements are towards success and getting them towards fee-for-service, towards value-based care and gaining the benefits of getting there. And again, as part of the team working with various, we have the experience working with across various commercial payers and other agencies and programs across the public sector as well. Next. Again, for making to be understanding these core elements of the programs, it's important for us to stay tuned into some of the policies, standards, best practices, evidence-based guidelines, and others that come across these specialty programs, working with tuning into what their policies are, but not just tuning into the policies, but trying to drive some of those policy changes and infuse some of our own thoughts and best practices, lessons learned into it, so that that guides future policy decisions across the board, across specialties. Also driving some of our own feedback into, HSCRC and others have been great over the years in taking our own feedback, CMMI and others, and so that as we are supporting the program, we're not just getting involved in the end, but trying to drive what those programs evolve to be from the beginning towards the inception and also as they evolve over time. Next. Again, I keep repeating myself many times, 100% value-based care and majority of our work is in Maryland. Again, we touch various counties across the board. Understanding specialty behavior, the referral patterns, the episode level triggers, triggers, I shouldn't use it here, but then the drivers in terms of what those drivers are. And understanding, why the connectivity of the data is important across the board. To make sure that we are informed, we're able to nudge the practices and entities to make the right decisions or avoid certain decisions so that they succeed in the programs they are. We're fully entrenched into understanding even round one in terms of understanding the requirements and what you need to do to fulfill the goals and objectives of the program. So again, we are ready to partner with you to move forward. Again, key thing is we're local. We're not exported from out of state. We're here local, here to partner and expand our growth within the state of Maryland. Next. And as I mentioned, we've been a care transformation organization here in Maryland since inception and growing. And we've always take pride in saying that, we're the top performing CTO. And again, what that means is understanding the requirements of the practices, seeing what triggers they need to do to make sure that their processes are driven well, the data is used, and the workflow is optimized so that they can succeed in the program. That's how we succeed and grow within the state of Maryland. And again, the trust that we have instilled within the practices, the CMMI and others, talk to the team of, how they work with the practices and support them and guiding them to what they need to do on a daily basis. Next. Again, the key priorities. You signed into it. You're with the program. That you have to be. You're responsible for the, controlling the cost, enhancing the overall quality, and instilling the value-based framework into what we do, what you do. But then, what are we? We need to understand, and that's where we are in terms of understanding the overall program goals, understanding of financial accountability, care redesign, quality enhancement, in terms of clinical data integration, practice engagement, and others. And if I can tell you, I mean, that's what we do on a daily basis in terms of getting those physicians, providers, other ancillary staff, and the patients engaged for us all to succeed together. Because it's not a one size fit all. We need to make sure that we work with each one based on their maturity level of the process to help them succeed in the program. Next. Again, as you look at the EQUIP program, some of you have been in the program for a while, some of you starting out right now. I mean, it may be daunting in terms of seeing what you need to do and what those success criteria are like, right? So, and that's where we hope to provide that, pathway in terms of simplifying that reporting, creating the operational efficiency, clarity, creating the dedicated leadership, because you're going to be focusing on the clinical aspects and other program aspects within your own day-to-day and feel overwhelmed in some of the complexities of the program. And so we are here to understand those requirements and trying to deliver those results, whether it be the quality or the cost and overall satisfaction or the patient satisfaction. It's all the same in terms of what those success criteria we need to apply to with a different mindset and help the specialists integrate VBC into a daily practice. Next. Again, I mean, in terms of scale, we are designed to scale in terms of the tech stack. It's designed to load up to stress test to load up to 3.5 million VBC lives into the program, and stress test to add close to about 300 entities and beyond. So in terms of who we are and where we are, we've always been pressure tested to make sure that we can add on, and scale. And so we're excited to support as many as the entities and programs and practices are there within EQUIP to help you succeed in 2026. Next. So again, as I keep mentioning, the team will keep mentioning, is it's not a one size fit all, right? We need to understand the diverse specialties that are within EQUIP, understanding what those, not just applying some generic models. We want to make sure that we engineer specialty specific, solution sets, understanding what's out there within the program and what's out there. I mean, and we have created our own, episode engines and others that's going to be driving some unique opportunities for each of the practices entities. We understand the playbook, right? We have taken that and tried to customize it to create our own episode engines, what those triggers are, what those look back is, what are the exceptions. So while the EQUIP team is going to be giving us those dashboards, we'll consume the data to try to further slice and dice. Next, please. Again, the overall goal is to almost create this plug and play so that data is available within your point of care, within your EHR. Again, one thing me and the team will keep mentioning, I hate being referred to as a vendor. Again, we want to be referred to as an extension of your practice, as a partner. It's just a screenshot from one of the practice visits a couple of weeks ago. Again, we want to be integrated within your day-to-day and make sure that we support you in your needs and identify the gaps that you have. Some of you have different levels of maturity or where you are, how you can consume the data, how you use the reports that's out there. But some of you need a little bit more hand holding as to how you use the data and get you to success in each of those programs. And that's where we hope to do that. Next. Now I'm going to turn it over to Sunaksha Casey. She's our Chief Transformation Officer to go through the solution set. Sunaksha.
Yep. Thank you, Armani. Hi, everyone. I am Sunaksha, and I am the Chief Transformation Officer for all of our value-based care programs at Netrin. I work very closely with our partner practices and physicians to help them succeed in multiple programs, and I'm very excited to be able to partner with everyone who is looking at our presentation today. And in the next few slides, I'll be sharing our capabilities and how we can help you succeed in the EQUIP program. So before we dive into the solutions, let me highlight some of the challenges that I see from the practice perspective. And I'm sure each one of you may have, at least one or multiple of these challenges as you're partnering with HSCRC in the EQUIP program. So some of the challenges could be even understanding the requirements, financial pressures in balancing revenue with quality, impact of EQUIP transition on provider workload and burnout, staffing shortage, staff training and data competency, and more. So I'm hoping that Netrin can bring solutions which we have and to help you address some of these or all of it at your practice level. So the four areas that we can help you in includes data analytics and population health management, EHR optimization, practice transformation and leadership engagement, and care management and multidisciplinary care team. By addressing these, we're hoping that we are able to help you at the end of 2026 in achieving shared savings and optimizing your financial performance, helping you understand the data in terms of population health management, providing end-to-end transformation support, and streamlining the operations at your practice level. So in the data analytics and population health management, we bring in a huge experience in terms of understanding the claims data, the EHR data, social determinants of health data, wearables, or remote patient monitoring data. We're able to aggregate all of that into our pipeline and refine that so that at the end of the day, we are able to provide you with actionable data to engage with patients, care teams, or specialists in terms of coaching, education, or intervening any clinical needs that the patients may have. In terms of our capabilities, in order to provide the whole person care and the platform, as part of our data analytics and population health management service, we are bringing in comprehensive data integration, providing data-driven insights, real-time alerts, as well as insights at the point of care. What it means for the practices is, in terms of the data integration, we will be aggregating all the data, whether it be clinical claims, STOH, CRISP, or utilization data, so that we are able to provide that 360-degree patient view to target high-risk population. Our team will be focusing on looking at the data and analyzing it so that the providers don't have to worry about logging into CRISP and looking at some of these data that you can make an impact on. We'll also be leveraging CRISP and EHR for actionable practice-specific recommendations. So based on the episodes that you are participating in, we'll also be helping you understand, some of the high-risk patient population that needs to be addressed, some of the pre-trigger and post-trigger episodes that can be leveraged, and how to avoid some of the unavoidable or unnecessary utilization in terms of ER and inpatient. We are also directly integrated with CRISP. So in terms of receiving real-time event notifications for admission, discharge, or transfers, we're able to close that gaps in care and address any needs the patient may have pre or post visit. At the end of it, insights at point of care is very important. We don't want the providers to be logging into multiple different portals. So leveraging the EHR integration, we'll be providing all this critical information directly at point of care for your practice. So what does it mean to you, right? We will be doing a lot of the work on our end in terms of analysis, but what do you get at the end of the day? So in terms of the practices, one is CRISP and EHR data reconciliation. Instead of requiring the providers or the office staff to navigate to CRISP systems separately or managing a different logins, we will streamline access and making it easier so that the providers can view relevant patient information without the need of multiple logins. Understanding the equip benchmarking is equally important. So we'll also assess performance for 2019 benchmark and suggest areas of improvement based on your performance and updated trends. We can also help you identify cost outliers, enabling focused effort to reduce unnecessary expenditures. The third part is quality improvement insights. Equip has three different quality metrics that everyone needs to be accountable for. So we'll be parsing data, uncovering reports in terms of how you can improve the quality measures. How can we provide you with a list of patients who are due for their ACP or who have not done their BMI screening, or in terms of medication reconciliation, we'll be able to help you with that as well. We also want to make sure that the data that we present to you is something that's actionable, easy to understand, and provide clear path in terms of provider intervention and decision making. So we'll be helping you with program performance tracking so that as you proceed in 2026, we can do a regular touch base points where we are able to help you track some of your performance in terms of cost, the trends, as well as the quality. The second solution that we'll be helping you with is EHR optimization. Based on my experience and our experience as a team, we've found that getting the providers to log into and actively engage with a new system can be challenging. So we want you to leverage your EHR because that's something you use on a day-to-day basis. So all the data that we will be providing to you will be brought into our platform, which will be integrated with your EHR. These are some of the EHRs we are already integrated with. And if you don't see an EHR that's here, then it takes us like a week or two to integrate with your EHR. So we can work together to see how we can make the best use of the EHR that you are currently using. Again, we always ask this question in terms of how do we make the most out of your EHR. So instead of introducing a new system to your practice and the providers, we'll try to help you in terms of how you can make the most of your EHR. So that includes data integration directly into your platform, helping you create and set up templates, smart templates, order sets, or shortcuts that can improve your quality measures and performance. um, Data capture for equip, ensuring required fields, screenings, and quality measures are captured correctly will help you with data capture for equip directly in your EHR as well. Setting up alerts and care gap management for any patients who may be due for any of the quality measures or maybe even like preventative visits or screenings will help set up alerts directly in your EHR so that when you see the patient in the office, you are aware that the patient has certain gaps in care. Provider and staff training. I understand that at your practice or every practice, every provider may have a different way of working in terms of documentation or the workflow. Even the front staff or the back staff may have a different workflow. So, as we are working with your EHR and presenting the data to you, we'll also be helping the providers and staff understand how exactly to do this in terms of their current workflow. So we'll deliver targeted training to help you use your EHR in terms of how you can make the best use of it. Data accuracy and consistency is equally important for us, strengthening data integrity to ensure you're receiving accurate data as well as you're inputting accurate data in the EHR because a lot of the quality metrics can rely on the data accuracy and consistency. So we'll be ensuring that we're strengthening that for your practice and understanding the back end of the EHR. So your practice staff or the office manager doesn't have to spend a lot of time understanding how the EHR works. We'll bring that expertise to you. Last but not the least, interoperability enhancements and documentation efficiency tools will also be helping you with this so that any external systems that the practice needs access to, whether it be like labs, hospital, care management platforms, we'll make sure that is integrated within your EHR so that there is a seamless data flow for your practice.
Naksha, we have an actual question. If you want to stop for a minute, or do you just want to go ahead and do your presentation first and then we can do questions? How would you like to do that?
I think we'll take the questions at the end so that we're able to
Okay.
cover everything. Yes.
Perfect.
Thank you, Kim.
Mhm.
Yeah, and I think my team is also able to answer any questions in the chat. So if anybody has any questions, feel free to add it to the chat as well. Yeah, thank you. The next important part is the quality improvement for the equip practices. A lot of the times I get this question a lot that I'm addressing all these quality measures, but why is the report showing a lower percentage? And a lot of the time it has to do with how the provider is documenting it, how the EHR is capturing the data, and understanding the technical specifications of EHR can be very time consuming. And we already understand that. So, we try to make sure that we will help you reduce as much documentation time that you are spending as needed, automate anything that can be in terms of these quality measures, and help you improve performance there. For the next two sets of solutions, I will pass it on to our Director of Engagement and Growth, IPEC, to cover the next two slides. Thank you.
Thank you, Suneksha, for walking us through the data analytics and the EHR integration capabilities. So I'd like to move into our care management support here at Netrin. As Suneksha mentioned, we built the care management model around a whole person care approach. So what that really means is we don't just react to clinical events. We proactively surround our patients with the right team, the right plan, and the right engagement throughout the care journey. So, that being said, I'd like to walk you through these 4 pillars we have in our whole person care model. The first is our multidisciplinary care teams. So they provide coordinated support for every patient, every need across clinical and administrative teams. Our care managers will work directly with providers, specialists at different levels, and your practices staff so that the patient's journey is seamless, not fragmented. And the second is high risk patient plans. So we build personalized care plans for our high risk patients, especially those with complex needs. This helps us anticipate the complications earlier so we can reduce the avoidable utilization and keep the patients on track with their disease and episode specific goals. And the third is coordination and staff training. So we equip the care teams, including your practices staff, with the processes and workflows we create so that everyone is involved, knowing what to do, when to do, and how this all supports the episode performance at Equip. And last is patient engagement. So we finally focus on proactive patient engagement at all levels. So this is where we involve the patients and the caregivers as needed in the decisions, expectations, and self-management. So by keeping the patients informed and empowered, we help them stay engaged and on track with their care. So that at every part of the episode, the patients are fully supported. Just to quickly show how our care management approach can translate into real world patient experience. So our model is structured and designed to reach patients at the most critical moments in their care journey. So whether that's a cardiology procedure, a follow-up after a hospital discharge, or just a rehab appointment, we tailor our outreach based on the clinical pathway and the timing of the episode. So just to review some of these examples in these icons, the first is we do have episode specific follow-up surveys. So these will be sent to make sure the patients have timely symptom checks, adherence, and recovery monitoring. So, just as an example, if a heart failure patient gets care management support, we can just check the symptoms, make sure the medication adherence is there. Or for hip replacement, it can be like monitoring the recovery milestones and making sure the mobility progress is there. So after the surveys, we do also have the next component, the social resource screening. So at Netrin, since inception, all of our care managed patients get screened for social needs. So these can be needs for housing, transportation, food access, and more. We connect our patients to local community resources when those needs become real barriers to their care. For instance, if again a patient is recovering from a knee replacement or lacks transportation for their appointments, we connect them to the community resources and make sure they can attend those appointments. And the next is our care manager calls that are automated. So our system triggers automated and personalized care manager calls for monitoring, reminding them, and checking in with the patients to make sure they are on track with their care. The next is TCM post-discharge follow-ups we have in place. So at Netrin, a major advantage we have is our integration with CRISP. So as we receive ADT alerts in our system, the system automatically identifies those patients who are discharged. So we send text reminders for TCM follow-up scheduling. And the TCM doesn't stop at automation here. Our care managers also call those patients directly so that we can reinforce the importance of these follow-up appointments. And then the next, we do have care gaps and quality measure outreach. So we're also designed to support Equip's 3 key quality measures. Let's say if the patient needs ACP discussion about their advanced care planning, medication reconciliation, or BMI screening, the care managers can also help close those gaps in care by educating them, coordinating between providers as needed, and prompting the action where needed. And last is the patient education, which is extremely important. So we do provide targeted patient education materials based on disease and episode. So we do help them understand what symptoms to watch, when to seek care, and how to stay adherent. So the main goal is to prevent complications, of course, but also avoid unnecessary ER visits and guide them to the most suitable and often the lower cost care setting here. Next slide, please. This is on the final slide for care management, just to show how this coordinated care looks like in action. So this three-layer view shows how the care teams operate at the top, how your patients experience the support, and what impact we create in the program at the bottom section. So at the top layer, you can see a snapshot of what the care teams deliver. So we begin by reviewing the EHR and CRISP data and any episode specific triggers so the care managers know exactly when and how to intervene. And then we engage the care teams for alignments where we coordinate the care partners, such as for aligning the visits, procedures, and coordinating referrals and more, so that the entire care pathway is organized. And finally, like we mentioned, we do assess for SDOH and address them as needed. We provide reminders and monitor outcomes consistently. So in the mid layer, you may think, how do my patients experience this support? So first of all, patients feel supported in managing all their appointments and procedures, which can be otherwise overwhelming for Medicare patients. And then next, they understand the next steps in their care journey. They know what's coming next, whether that's their next visit with their specialist, why they need to attend, prep instructions, and other timelines. So the result is fewer delays or fewer missed procedures. At the bottom, what's the impact we create for the program for Equip? So we do see improved preventive care compliance with our care management in action. We do see reduced avoidable complications and costs. This is where we see the financial impact the most clearly. And last, we are able to track patient level outcomes for all the program targets. Now I'd like to talk a little bit more about our practice transformation and leadership engagement support for equipped entities. So in our model, we do have four key components, and the first one is our workflow analysis. So when we work with the practices at different levels, before we can provide any recommendation or any strategies, we need to begin with a structured assessment where we can see how your practice is currently operating. So this includes analyzing episode performance, any utilization patterns, avoidable ED use, any staffing workflows, and any operational challenges you may already have. So these insights will allow us to pinpoint specific and more realistic opportunities for improvement within your practice. And then next is we do provide actionable best practices. These are proven strategies to help optimize operations, address areas for improvement for your practice. And each one of these are tailored to your specialty, your patient volume, and the episodes you're managing. So we provide them using both the data and the day-to-day realities of your practice so that the strategies are relevant. And the third is streamlined program support. We understand that some practices consider hiring additional staff to manage this program, and that can be a real challenge. So at Netrin, our goal is to be your operation partner and guide you through everything from program requirements to reporting to documentation and more, so that any complex administrative tasks can become simplified for you without needing to hire additional staff. And the last component is customized improvement strategies. So as we simplify the program demands for you and help shape your workflows around measurable performance goals, we respect how your practice operates. So we want to tailor the strategies to fit your infrastructure, your staffing, your culture, and your own constraints. So at the end of the day, our practice transformation approach is simple. We like to understand where you are. We'd like to design the strategies that fit your environment and build a clear and achievable path for your practice. Here, I just want to emphasize again that there is no one size fits all solution at Netrin. We know that every practice we may work with is at a different stage in their journey, like Armani said, at a different maturity level. So, some entities may be still building the foundation, understanding the basics of the program. Others may be already knowing what's not working, but not sure how to overcome the challenges, or some may be navigating the capacity issues and considering hiring additional staff. So that's exactly why the support we have is flexible. We'd like to tailor each component, such as your workflows, leadership engagement, and our practice coaches, so that your specialty, your size, and your team and your constraints are considered. And in the next slide, as we conclude this section, again, we support practices at different maturity levels. So this is just a sample to show how we provide a series of playbooks for entities in the program. These will be basically step-by-step guides built from real-world experiences across specialties and clinical episodes to help you succeed based on where you are in the program. As we close this portion, I'll just turn it over to Armani for the closing remarks.
Thank you, Beck. So again, as you had seen, I mean, there's a lot of complexity, I mean, in terms of the program, and our job is to try to simplify it and come up with a process of getting you from point A to success of through the program. Next slide, please. So one thing is our job is to understand and decode what the requirements are. And I mean, for the last year, we've been doing that and making sure that we get all the elements together. While there are, various programs and, the current infrastructure in place from Equip itself, our job is to make sure that we consume that, like I said, and create our own episode engine. So that's what we've been doing. And, it's not about a one size fit all, and each one shouldn't be daunted into thinking, is this too much for me? I think we know where you are. It's about hand holding you into success based on the levels of maturity. Next. So over the last 20, 25 years, I mean, I always believe that you come up with a certain structured implementation methodology across the program, across each of the domains that we need to be successful. Don't get, worried about looking at the number of phases. It's just a sample to say we want to follow a certain structured approach if possible. I don't want process to kill, innovation or making sure that you feel that we have too much to deal with. I mean, we will tailor whether it be a two-step, three-step, five-step, or eight-step process to come up with what those are to get you to success. So don't feel overwhelmed. While I like process, I don't like process killing innovation and getting you bogged down with too much paperwork. And another thing is about the staffing, right? You may not have another staff to help you with. So as Ipek mentioned, our job is to make sure that we are there's additional resources to help you beyond what your day to day is. Next. So in terms of phase one, so again, how do we bring together almost like a launch, getting you creating a 90-day roadmap for each of your practices, entities, specialties, or where you are, identify who that champion is within the practice, and or seeing who wants to, who understands it, or who wants to understand it, step into the role in guiding you. Our job is to understand the data, bring in the various data elements, and understanding the various, best practices that's out there based on evidence-based guidelines, and seeing what has worked, what has not worked nationally, regionally, and how we can get you to. And it may be your specific zip code of how you service that line of patients, and based on the SDO, it's maybe they're more prone to X. So I think we'll need to work to see what those triggers are for that episode and how to help you. Next, the data integration. And I can't stress enough, I mean, that's our bread and butter in terms of trying to understand what's that episode level cost, the leakage, the variation dashboards, and mapping those specialty drivers by specialty and constructing that, provider level cost model, quality model, referral map based on who you are and how you serve. Next. And then in terms of phase three, again, don't get daunted by the process. These are subject to change based on who you are, what your needs are, your specialty, and what you can handle. and again launch, apart from, Kim and team have come up with amazing, various dashboards. How do we ingest that and come up with certain spoon feeding you into what's needed? And it's our job to find out what led to some of those, episodes, and trying to see what that look back as, what are the exceptions, trying to standardize some of the clinical decision pathways based on who you are, and, and also try to come up with those hurdles with your practice or entities or others, whatever. There's not a one size fit all, to see what has worked in the first 3 months, 6 months, whatever. Again, we may need to readjust where we are, and then get to, what that, we need to maybe redefine what the success criteria looks like, and it may be an iterative process. It may be from step 2 we may go to step 1 again, and some may be iterative, some may be a waterfall approach. And again, the overall goal is to take the data we have and coming up with a various practice transformation that is more operational, and documenting what the success looks like, and getting you to meet those program goals. Next. Again, don't get daunted. Again, in terms of, for you, we'll make sure that, we are intervening in terms of whether it be the care teams or others, various patient level engagement, getting those caregivers, their own families or others engaged, various screenings, and making sure that those are tailored for that particular specialty. So, and there could be two different, ortho practices that have completely different workflows, needs, maturity levels. So we're not going to be shoving down something which does not work for your practice. Next. So data integration, I can't stress enough. Again, I mean, I know Kim and team have done a great job of getting some of the data elements out there, but based on our own capabilities to be able to normalize and ingest that additional data, we can come up with those additional analysis. I think Kim and the Equip team and the practices, we're all going to learn together. And certain things, we're going to go reach out to Kim and team and say, hey, what has worked, what has not worked? How do we, what is that area where you think we need to step up more for this particular practice, right? So it's not, we're not just not going to run with it. We're going to be definitely having multiple huddles across groups. One thing that we've done, even in our, work on the day-to-day, we bring together, workshops with multiple practices together to learn from one another and try to implement that across our practices. Next. Yeah, again, there may be certain program level governance, reporting, and others that's required. Some practices may feel daunted in terms of the requirements of what that is and how do you close out the year. So we are there to, that's what we do on a daily basis with our MDPCP program as well. How do we help you with, meeting those goals, the reporting requirements, the governance and others. And that's where we are to help you in navigating through that. Next. So, I mean, in terms of, being a one-stop shop, we wanted to make sure that you're not going and trying to, go into your own tool chest for any of these capabilities, right? So, whether it be the data analysis in population and health management, integrating the data into your EHR, creating those templates and optimization within your EHR, or analyzing the existing data or ingesting other sets of data and trying to come up with some new trigger points of what needs to get done by practice, by specialty, we are there. Again, we want to see what those existing, evidence-based guidelines are, what works and what doesn't work for you, and tailor those to you, and infusing the team in terms of engaging the patient, whether it be tools, process, and others, to get not just the providers and the practices, who's on the call, but also the patients and their family and their caregivers engaged, for us all to succeed towards succeeding in this program. Next. So our job, again, over the last year, we've been ingesting, the various nuances of the program. What are the triggers that's going to be making each, program successful for each specialty? I mean, I think we're here to hit the road running for Jan 1 and trying to understand, how do we work with each practice? I mean, to deploy the teams. I mean, understand your requirements. And Kim, with you and the other members of the Equip team, we're certainly going to lean to you in seeing what has worked over the years, what has not worked. It's going to be bi-directional in terms of learning from each other and implementing. We're not just going to think, oh, we know everything and running with it. I think we're all going to learn together. We're going to infuse some of the best practices that we know already, what has worked, what has not worked, and infusing it based on what has not worked in the program before. I think we all want this to succeed. Next. again, we worked across various programs with Medicare and Care First and others. We're still learning as we go. I mean, I think if we have the mentality that every day is learning, I think we can all succeed. We are here to be your partner, and I don't like to be framed as a vendor. Looking forward to working with you all. We can, next slide, please. Yeah, again, it's about a community. We build communities, working with practices and seeing how we all work together. And looking forward to working with you and partnering with you and making you successful in the EQUIP program. Next. So thank you for, again, on behalf of Netrin, me, Suneksha, and APEC, thank you for giving us the opportunity to present. Look forward to working with all of you. Open for questions right now. So I know there was a question that was typed in the chat. It was from David. I'll take that, and Suneksha, I'll start addressing it. You can chime in. David, there is no requirement. I mean, while we want to optimize workflow and get that data, integrated such that while you're there in front of the patient or in your EHR that you know on day to day to integrate that data, we can certainly make that data available offline for you to work with it. Another thing is, I mean, over the last 15, 20 years, 18 years, I've been doing data integration at the enterprise scale, whether it be the old Cerner days or the Epic. Again, we're not going to go the traditional route of the long, lengthy integration cycles, David. I mean, we have found ways of coming up with plugins, integrations that work with across multiple web-based EHR, non-web-based EHRs to get that data integrated so we can work with you. Again, if that data integration is something daunting or something you don't want to do, data is available offline. Ideally, we'd like to integrate within that workflow. And if it doesn't answer your question, you can type the question again.
Thank
So, do you want to add to that?
No, Arvind, I think you've addressed it.
Okay, great.
Thank you.
Any other questions, please?
You can either type it in the chat or you can raise your hand. Well, I guess you all did a beautiful presentation and no one has any questions. When I send out the final, the actual videos and the slide decks from all of the presentations, I will also have contact emails for each of the vendors that we have. So if there are specific questions that you want to ask, you can then reach out that way.
Him and the EQUIP team, on behalf of the team, again, thank you very much. And to the practices who are on the line, look forward to working with you. Thank you again. Have a great day.
Thank you.
Thank you.
Thank
Bye,
you.
everyone.